Get CareSource PHI sharing wrong, and one accidental disclosure can carry heavy fines and career-ending consequences. Addiction treatment providers must share certain protected health information with payers to get paid, but PHI is heavily protected under HIPAA. Every payer writes its shareable client information policies a little differently. Today, we focus on how CareSource Management Group treats PHI. We will cover what you are allowed to disclose, when sensitive diagnoses need special consent, and how to manage CareSource's payer-specific rules. So what are you actually permitted to disclose to CareSource? Every party in an interaction between a treatment center and a payer is a HIPAA-covered entity. Under HIPAA Regulation 45 CFR 164, you may share patient information for treatment, payment, or healthcare operations. In other words, most of your day-to-day interactions with CareSource are legitimate occasions to share client information. Get the boundaries wrong, and a single non-shareable disclosure becomes a HIPAA violation with heavy fines and professionally catastrophic consequences. CareSource spells out the rules in its Marketplace Plans Health Provider Manual. The clearest summary sits on page 88. Look under the section titled CareSource Patient Rights and Responsibilities. All of it applies to addiction treatment providers. 3 rules separate a clean CareSource relationship from a compliance problem. Let us walk through all 3: disclosure, sensitive consent, and verification. Rule 1. Know exactly what you are allowed to disclose. You may share to support treatment, to seek payment, and to conduct general healthcare operations. Also permitted, payer quality assessment and improvement programs, and population-based inquiries to improve health or manage the cost of care, and general case management inquiries, plus all payer and provider-initiated care coordination activities. Rule 2. Sensitive health diagnoses always require special disclosure consent. Substance use disorder always requires special consent beyond a standard authorization to disclose PHI. The same applies to genetic testing results, HIV and AIDS, mental health concerns, and STDs and STIs. Always encourage patients to specifically initial the sensitive diagnoses section before you share it with anyone. Rule 3. Check consent before you disclose anything sensitive. CareSource records every patient's health record sharing consent inside its provider portal. Log in, then search for the patient under the member eligibility option. If the patient has not consented to sharing, a message appears stating exactly that. Here is what trips providers up. CareSource operates primarily as a Medicaid managed care organization, so its rules diverge from commercial payers. CareSource serves members across multiple states including Ohio, Indiana, Georgia, Kentucky, and West Virginia. Prior authorization requirements often differ from commercial carriers. Medicaid plans typically require auth for residential and inpatient substance use disorder treatment. Medical necessity criteria align with state Medicaid guidelines, so your documentation must address state-specific benchmarks. Staying in-network with CareSource takes more than good clinical work. Meet credentialing and re-credentialing deadlines, submit updated licenses, malpractice insurance, and facility certifications on schedule. Late submissions can cause a temporary loss of in-network status, which disrupts patient care and revenue. And document to the level of care billed. Claims without adequate clinical documentation are more likely to be denied. This is where an integrated platform helps. BehaveHealth.com is designed to track payer-specific rules like CareSource's in one place. Automated eligibility verification confirms CareSource coverage, plan type, effective dates, copays, and authorization requirements before services begin. EHR templates are designed to embed payer-specific prompts, guiding clinicians to capture what CareSource requires for each level of care. And tracking denials by payer surfaces patterns. So if CareSource denials spike on a code, your team can address the root cause. Stop letting one wrong CareSource disclosure put your license and revenue at risk. See payer-specific billing built for behavioral health. Book a 20-minute demo at behavehealth.com. Our specialists work only for behavioral health providers. Verification, denials, appeals, and more. Book a 20-minute demo at behavehealth.com.